Now, Jane, my prep for going into hospital was like a military operation. I took just about everything in the kitchen sink with me in a suitcase, which I guess did make it better for me, knowing that I had all the things that I wanted to have with me, that I could relax in hospital, and I'd been through all the lists of what other people have suggested. But what would you say are the key things in preparing to go into hospital, and what are your top 5 things to take with you?
Oh, top five. Gosh, I didn't know I was going to be asked top five. I'll have to think about that. So, uh, prep. I'm a bit like you. I kind of wanted to take everything. Um, I'll start with the end bit, in that I took way too many clothes, because
Yeah.
obviously, how many outfits do you need? I was actually in hospital in the end for 3 full days, but what I desperately wanted to do, and I've only really been in hospital once before properly, overnight, which is when I had my son, the one that resulted in my issue. And that was many years ago. And I remember really being upset that I didn't have nice nightwear, sort of pajamas or whatever, that I could sort of slouch around in, that weren't too frumpy and weren't too, that just felt like me. And that my nice toiletries were also available. I also knew I didn't want a very tight bra, because I didn't know how painful I'd feel, even though I wasn't having an incision. So I did invest a little bit of money beforehand, and bought myself, from more of a fashion store than a pajama store, bought myself a nice, almost like a little shorty running top, with an integrated bra, soft bra, which I thought would be nice and comfortable, but still make me feel normal. And some pajama bottoms are a bit more like leggings. So I thought, if I wear those, I'll feel like I'm not wearing pajamas, and it will feel a bit more normal. So,
Yeah.
and as it happened, that was really useful. And the day after my operation, I was washed, dressed, and wearing those, and felt very normal. So that, I think, wearing something nice, even if you just take one thing and it's pajamas or it's an outfit, that's important. I also didn't use this in the end, but what I took was some peppermints, little droplet bottle of peppermint, because I knew I'd probably feel a bit nauseous
Yeah.
afterwards, after the op. And I didn't, in the end, I didn't need it, but that's good for some people. Also, on the note of your gut, it's useful to take something. Again, I didn't need this myself, but if you're having an invasive operation like that, it's useful to take something like um, Rennie or Windies or something, because you can get
Yeah.
quite bloated, as I'm sure you know, because they fill your abdomen with air. As it happened, I didn't suffer with that, but those sorts of things can relieve the discomfort. Prior to the op, I had about 2, maybe 3 weeks prior to the op, I'd already started taking zinc and vitamin C supplements, because vitamin C, obviously, we know vitamin C is good for you, helps with your healing, but also zinc is really good for healing. So I planned to do it a few weeks before and a few weeks after, total of about 6 to 8 weeks. And that, I definitely think that helped. I definitely felt like I was healing really well. I didn't feel that there was any issue at all. Obviously, having a good surgeon helped, but the zinc and vitamin C were really good. Um, this isn't going to be top five, but there's only a couple more. The other thing was, I had taken a book in with me, but I realised that I really couldn't concentrate very well.
Yeah.
You know what it's like, post op, post anesthetic. I just couldn't focus. I couldn't relax enough. So I had my phone with me, of course, and I had brought my earpods, and I listened to podcasts and music, just nice, relaxing music, which I found much better when I was struggling to sleep properly. That was nice. The TV was rubbish. I think there were only 2 television stations in the room, so it had to be something I could take my mind off things with. Obviously, a charger for my phone, important.
Yeah.
And the other thing was some of the toiletries and nice things that you like. So my favorite perfume, and do you know what? It wasn't. I know this sounds really awful, or silly, really, but it wasn't just for me to have my favorite perfume, but when you're in that little tiny hospital room, because it was a little private room, people are coming in and out all the time. And I think it's quite respectful and nice to make yourself smell nice and fresh and clean for them. I
Yeah.
really do, because you're kind of lying there festering and sweating in your bed. And I made sure I could have a wash as soon as possible. I just said, when can I go and have a shower in the little room next door? They said, whatever it was, 10 hours later or whatever. And I made sure I smelled really lovely. And I was so pleased. And one of the nurses came in and she said, "Oh, it smells lovely in here." And I'd put a bit of lipstick on and I just felt like I felt normal. And it was just nice to know that I'd made it a bit better for them too. So those are my top tips.
I go with those totally. For me, yeah, I was the same. When I woke up, I was very sore across my midriff, even though I'd not had the traditional open
Yeah,
surgery. I had it was really sore and I couldn't move around much. And having my phone so I could listen to podcasts
yeah,
and audio books and things like that, just to take my mind off that pain,
yeah,
was really, really helpful. And at that point, I still had a catheter, so I couldn't really move in the bed very well. So it was nice to just sort of lay there and listen to those as I kind of was dozing in and out.
yeah.
Um, yeah, definitely just taking nice things, right? Just having things
Just
that make you feel really comfortable. And I was the same, body spray on, and feeling really fresh. And also getting, once I was able to sit up, getting out of the horrendous surgical gown,
oh God.
and putting something on. I did the same as you. I got, but I didn't take sort of leggings and things. I managed to find these really nice long nighties, and I didn't want the horrible Winceyette thing, with the fluffy collars. But it was made from t-shirt material.
Nice.
So it was like wearing a big baggy t-shirt right down to kind of just past my knees. And I bought
Nice.
a couple, and they got pockets in,
Love a pocket.
which was great. So you just could feel slouchy and
Nice.
comfy. But once I got that on, and I just felt like I was wearing my own stuff, it was so much better.
It does feel better. Oh, and the only other cozy thing you've just reminded me was I have I suppose it's a bit like a snood, but it's really a scarf, really soft white scarf. And if I'm going on a long car journey, I tend to kind of snuggle up to it.
Yeah.
And that's when I'm not driving, by the way, when I'm sitting in the passenger seat. So I took that with me, and although I had my own pillow, brought my own pillow, and I
Oh
had
yeah.
that with the pillow, so that just made me feel again a bit more like home. But ultimately, it would have been fine without any of those things, but it just gives you that little extra boost, doesn't it?
Yeah, I was the same. I got a big it's actually my husband's dressing gown, but it's got a big hood on it, and
Nice.
it's kind of really sort of silky soft. That made me feel a whole lot better. I just snuggled down in that,
Yeah.
and slippers. Don't forget to take slippers. It's
Oh,
really important.
I've got slippers with me, but I was having to wear those awful surgical
The
stockings with, and
stockings,
they've given us some little what they call slipper socks.
right?
So
Yeah,
I could have just lived in those, but yeah, slippers would have been a good idea, I think. Yeah.
yeah, definitely. Yeah,
Uh,
good, definitely good tips.
yeah.
Now, what was it like for you after the op? What were your experiences after that in terms of the post surgery kind of experience?
Immediately after surgery, of course, as you'll know, I was just sort of lying there like a rag,
Yeah.
and my blood pressure was very, very low. So for about 12 hours, I was drifting in and out of sleep, and I was so tired I couldn't wake up enough to take a drink of water, which would have helped with my blood pressure.
Yeah.
But so they were constantly having to give me fluids, which was fine. Once all that was done, the next day I was all good. But yeah, I think if I'm honest, I was probably I could have gone home after 2 days, but I chose to stay in an extra day because I was a little bit nervous of my prolapse repair,
Yeah.
because you have to poop, of course, before they let
Yeah.
you loose, and I just felt very nervous that things weren't quite right because it was quite major, having stitches sort of all the way from the outside all the way up the top, and and so I was just nervous. I wasn't in any pain. I came home. Husband drove me. It was in London. Drove me back, so it's a couple of hours, and so the car journey was fine. And then, as you'll know, Helen, from a it's not the pain actually. It's more from a tiredness perspective. You get
Yeah.
this crashing fatigue. I went from feeling, as anybody that's had an anaesthetic would say the same, I'm sure, went from feeling, oh, I feel okay, I'll just potter around, do stuff, and then, bush, you hit the floor because you just can't function. And I was trying to work at the time as well. I hadn't really taken more than a few days off work, so straight back into it, trying desperately to keep my eyes open. So a lot of it was just trying to not do too much, but do enough to be motivated, and then sleeping and more sleeping and more sleeping, which
Yeah.
isn't my normal way of working. So, it was quite difficult to do that. And I was constantly being told off for doing too much.
Yeah, I got the same lectures from my husband. "Will you stop doing that?"
Yeah.
Was the phrase of the week, I think. Just picking up a cup of tea or taking the empty cup into the kitchen. "Will you just sit down and shout me and I'll come and do it?"
I know,
Um,
I know.
so yeah, it was same kind of experience, but yeah, just feeling really sort of flaked out and tired and just
Exhausted.
snuggling up on the sofa and watching, binge telly for
Yeah.
about a week, and
Okay.
then desperately wanting to get back onto my laptop so that I could sit on the sofa and do work.
Yes.
Um, yeah, but I think I was kind of back into the work ethic within a week.
Same. Yeah.
And
I had the same. I had the operation on the 12th of October, and on the 19th of October, my community, we'd been accepted as, we've been selected by Meta to be part of their community accelerator program. And so that was going to be, and it's only coming to the end now, sort of up to 10 months of hard work in addition to my normal work. And I was starting that on the 19th. So it was a week after my hysterectomy and bowel repair, that I'm having to sit looking chirpy in on Zoom, talking to people I've never met before. So
yeah,
yeah,
I
it's a challenge.
I did a very silly thing actually, Jane. 10 days after my operation, I had booked with a business partner of mine to do some teaching at a university,
Wow.
and she carried all the stuff, but I went and with my walking stick, so I had something to, keep me sort of steady. But yeah, I walked into a lecture theatre and taught for a day,
God,
uh,
I don't do
which
that.
was a crazy thing to do. But
Yes.
having said that, I think because I'd had the robotic surgery, because the impact was so minimal in terms of the recovery from coming round from surgery, it was only a 2.5 hour operation. Um, I walked out of the hospital, sort of just over 24 hours after the op, and there
Yeah.
were ladies in my ward who'd had the more traditional open surgery, one who'd been there 15 days.
Yeah.
So from that point of view, I think we were both, you and I, both very lucky in
Yeah.
that we'd had that kind of surgery that meant
Yeah.
we could get back on our feet very quickly.
Yeah, definitely. It would have been a different kettle of fish, I think, if we'd had the traditional surgery. And I'm not sure how keen I would have been to have it, if I'm honest, because
Yeah,
I know it's a completely different ball game. And um, I I almost felt like I hadn't had major surgery, and I'm not belittling the fact that it was a big operation, but it really didn't. There wasn't any pain. It was
yeah,
just
it's
a bit
it's not.
painful the day after, but after that, it was okay.
Yeah, it's definitely a lot less impact. To have the open surgeries, I guess equivalent to having a cesarean,
Yeah,
really,
of
right?
course.
Isn't
Yeah,
it? It's the same cut.
absolutely. And who knows what else needs to be done from that perspective as well. There's also the more opportunity for infection, and you've
Yeah,
got a whole raft of things that could go wrong, which most of the time they don't, of course. But it's just much easier and safer, I think, if they are able to do it that way.
yeah.
Uh, I know
I
they
think
can't do it that way for all women.
Yeah, I was about to say, I think we should make the point as well for any of our listeners that we had this particular surgery because we were having a total hysterectomy. That's right. So,
Yeah, understood.
whereas if you're having radical, which is also the removal of the vaginal passage, then it's often done with the more traditional open cut because they have to be able to get in there and bring everything out. Also, in terms of if there are severe cancers as well, they opt for doing the open surgery because they don't want to risk
Yeah,
losing any of the material as they bring it out. So it really does depend on the condition of
absolutely.
your uterus and what operation they're actually doing.
Absolutely. And actually, because of what they found on my ovary afterwards, my surgeon said if he'd known that was there, he would have wanted me to have a traditional one
Yeah.
because exactly what you say, they wouldn't have wanted anything to spread. As it happens, I'm being monitored and they seem to think everything's okay. But, if he'd known differently, I wouldn't have had that choice.
Yeah.
So,
Yeah.
yeah. But, you've got to take what life throws at you, haven't you? So.
Yeah, absolutely. Now, going on from the sort of the immediate return home, you've touched on it a little bit, but what were your experiences kind of over the next sort of 6 to 8 weeks, and how you start to get back on your feet? What sort of things did you do to kind of get yourself back to normality?
Um, well, I lay around on the sofa a lot and didn't drink any alcohol for a while. And just I tried not to take painkillers, if I'm honest, because I wasn't really in any pain. But if I had any little tweaks, I tried not to take painkillers because I didn't want to upset my gut anymore. I think my bowel was running scared at that point. It was a bit kind of, so, so I was struggling a little bit with the not so much just the hysterectomy. That was seemed fine actually, but with the bowel repair, I struggled with my bowel being a little nervous. So I was living a little bit on Senecot and stool softeners, just so that I wasn't putting any pressure on the stitches. Um, as it happened, it was okay, but I did have a bit of a panic about perhaps 2 months after. I was really struggling to manage my bowel movements, and I was a bit worried that the whole thing hadn't worked. And I now know that it's not a perfect science. If you, mine was quite a severe bowel prolapse, so I would say it was a 4 or 5 out of 5. Um, I'm probably now left with a grade 1 prolapse. So it's not perfect, but then I'm not 20 anymore. So let's be honest, I can't expect perfection. I'll go back to your questions. I probably should have asked that at the time. What will I be left with? Is this going to fix it? Because actually, it has changed my life, but there's still a little bit of a prolapse, which then means I'm having to be a bit more careful with my gut and my bowel. But it's absolutely fine. But I struggled for a number of weeks. I was quite distressed for a while because I thought, oh no, it hasn't worked. I'm still in the same situation. I wasn't in the same situation, but hadn't really thought and taken into account that what I could feel when I was sitting on the loo or whatever was probably just the stitches and probably just the scarring, and everything feels a little bit different until it's settled down. Now I'm sort of 5 or 6 months in, pretty normal. Everything seems pretty good. But that sort of acceptance, and I don't know why I found this surprising, because I tell people this all the time, but again, it's my body, so it feels different when you're telling yourself. But that acceptance that it will take time, not only for the body to heal, but for the mind to understand that your body's just a little bit different now, just a little bit. And so, therefore, you need to make those adjustments mentally as well. Back to what you were saying before, that's another question that may need to be addressed: of how will I feel physically, and how will I adjust to that physical feeling?
Yeah, yeah. I would, similar to you, about probably about 2 months or so after the op, I had some bleeding.
Mm.
Well, it wasn't what you would call like menstrual blood. It was very brown, and I realised that it was obviously whatever was from where the
Mm.
stitching was the scabs were starting to come away or whatever. That scared me a little bit until I kind of realised, and within a couple of days, it had stopped doing it, and it was fine. So I think had it continued on more than a couple of days, I probably would have phoned the hospital. But yeah, it was clearly just the remains of the operation. So you've kind of got to prepare yourself for those sorts of things, haven't you? That
You really do, because it's not, ultimately, however strong we are, it's not a perfect science, and everybody's going to heal differently. And you just have to kind of roll with it for a few weeks, and that's difficult for somebody like me and probably somebody like you to do, because I've got better things to do. I'm too busy for that nonsense.
yeah.
I did actually go from, I asked for an internal examination maybe 3 months after the op. So I went to London to see him again. And he said, yes, actually, he said the stitches are taking a bit longer to heal. So that's why you're having a few problems. But don't worry, it's fine. And that was enough for me to know that he'd had a look and it was all good. And then, yeah, just feels completely normal now. And I'm probably the same as you, just carry on as if.
Yeah, yeah,
Really.
absolutely. Um, let's talk HRT, shall we? Let's get on to that, because I know it's a subject that a lot of women are quite concerned about. I have to say, I have had a really good experience in terms of the support from my GP, who got me sorted on HRT pretty much straight away. I was told after the operation to wait about 6 weeks before contacting my GP, just to let my hormones and my body settle. Because I assumed they'd just stick me on it straight away, but that's not the case. You still have a lot of hormones in your system, so you need to kind of get those down to where they're going to be before your GP kind of gives you anything. Um, and yeah, my experiences of getting HRT were great, but I know that for a lot of women, it can be quite a tricky experience. And what sort of questions do you think women should be asking, either post op or one, even if they're going through the menopause naturally? What sort of questions should be they be asking about HRT?
So if somebody was already perimenopausal before having the hysterectomy, the total hysterectomy, I would expect her to want to be on HRT before the op and to feel pretty balanced before the op, so that she is going into that op feeling as well as she possibly can. You're absolutely right. The hormones need to settle, of course, once the op has been carried out. And tempting as it is then to fiddle around with your HRT as soon as you've had the op, because you feel a bit odd. And I certainly thought, oh God, here we go, hot sweats, feeling awful. Ugh. But knowing what I know, I forced myself to wait until I fiddled around with my HRT. But once things have settled and your body's got used to being sort of post recovery, then it's time to reassess and decide with the GP what your doses will be and how you want to take your HRT. If you're not taking HRT and you're not perimenopausal before the op, then absolutely just wait for a little while, get the GP on side beforehand, in terms of, look, I am going to be going on to HRT, but can I see you, let's say 6 weeks, as you've mentioned, that 6 weeks after, and we'll just reassess, have I got any symptoms, how do I feel? You still had one ovary left, so you certainly had something going on. If everything's out, it's not going to take long for that surgical menopause to hit like a train. Yours was a slightly delayed hit like a train, because you had a few weeks of reprieve. But generally, if somebody's going to have everything out, I was already postmenopausal anyway and on HRT, so it didn't really apply to me much. But if somebody's going to have everything out, it's going to be days, I would say, in most cases, before she starts to feel symptoms and her body starts to get the message, so to speak. In my situation, I was still surprisingly enough, surprised that I did have to slightly alter my HRT a few weeks after I came out of surgery. I'd assumed that because I was postmenopausal and all balanced, I wouldn't need any changes. It's no, taking stuff out that isn't working anyway. But actually, I have had to increase my estrogen dose since the operation, only a little bit, but just a little bit to just to top me up. So I'm assuming then, even though I'm older and postmenopausal, that I probably had a little bit ticking along. I don't know, a little bit of estrogen. I've no idea what was going on with my ovaries, but perhaps just the removal of that tumor, the removal of the ovaries, just tipped me over the edge a little bit to needing a bit of an extra dose. But most women, I would hope, would feel able to just preload with their GP, have this conversation pre-op to say, look, I am going to want to, if this is what they choose, I am going to want to take HRT. I'm going to want to take estrogen. Can we talk about how that's going to happen? That's the opening conversation that needs to be had for all women, really, whether they decide to have HRT or not. That conversation about what am I going to feel like and what will happen to my body when my hormones have gone is so important. And I have one woman, in fact, it was only last week in my group, who, it just breaks my heart because this is quite common and it's so unnecessary. She had a hysterectomy 8 years ago, total hysterectomy, given nothing, no hormones, no nothing. She's now 8 years older. She is suicidal. Obviously, I'll be speaking to her and we'll be referring her over for some help. But she is suicidal, and I've said you need to just get to your GP and give them this information. I've obviously given her the information she needs, and she said I've tried, and he's just said you don't need hormones, you don't need HRT. Basically, go away. Here's some antidepressants, and that just breaks my heart because some women are absolutely fine. Some women are fine to go off and meditate or whatever they want to do, take supplements, things I know nothing about. But many women want the choice and want the option to add their estrogen back in. And they should be allowed to do that because estrogen isn't the bringer of death and doom. And I would urge anybody that disbelieves me, and I haven't got it handy, but there's a book called Estrogen Matters by Dr.
Okay.
Avril Blooming, which you may have heard of.
Yep.
And it's like my Bible. There are plenty of other excellent books, but it's just such a beautifully put together book of facts and practicalities and empathy. And Dr. Avram Blooming has, I think it's a daughter, and his wife have both had breast cancer, and he is
Right.
a massive advocate of
Well,
estrogen.
we'll make sure we put that link into the show notes as
An
well, so
amazing book,
people can click on
amazing
it.
book.
Yeah.
So yeah, absolutely. I mean, I could go on forever, but it just ultimately starting that conversation with the doctor before the op is so important.
Yeah. I mean, we've only really touched on HRT here, but I know it's a conversation that we could have an entire podcast about. As I've said, I've had very good experience about it. My GP was very good. As soon as I called him up and said, "This is what I want," he actually understood, and I made it clear to him. I suppose as an engineer and a scientist, I'm very much about the numbers and very much about the measurements. So I went and had a blood test to measure my hormone levels before my operation, and then had a second one afterwards so that we could see where the difference was. And my intention is to have another one in a 6 months or so time when the HRT is kind of, well and truly working, so that we can see where I am in terms of balance. But I although I was perimenopausal, I didn't really have many symptoms. It was only after the op that I had the most horrendous hot flushes. Especially at night. It was just prickly, horrible heat, which was very uncomfortable. As soon as I got the patches, which are estrogen only, like yourself, they just brought that down completely, and now I feel perfectly okay. So yeah, it is vitally important you have that conversation with the GP, and don't take no for an answer. I feel very passionate about women if they feel their GP is saying no, you don't need that, then go and get a second opinion.
I completely agree. And honestly, I'm so vocal about this, both in Menopausal Not Mad and in the private group, the free group, the HRT Truth Collective, because so many of us, and I've done it myself, so many of us just view that the GP is God, knows everything, and we just need to do as we're told. And actually, most GPs are amazing, and they are so grateful for you saying, actually, can I just tell you what I know? And can we have a little bit of a conversation? I'm not here to slate GPs, because most of them are so caring and they want to spend time with you, but they don't often have the time. So therefore, it's quite nice if you can go to them a little bit more informed and say, well, actually, I kind of know this. So do you think I could just at least try patches or gel or whatever it is? And that's so much more helpful for both you and the GP, because it's less effort for them. They know that you've researched it. They can easily look up what you've asked them to prescribe. There are no real issues. I mean, I would never recommend something that the GP couldn't prescribe anyway. Um, but it's there are some really dangerous practices out there with HRT, mainly from people's ignorance. I often have women say, oh, I'm a bit intolerant to the progesterone, not women who've had a hysterectomy. I'm intolerant to the progesterone. I've just stopped taking it. And I'm like, no, that's not what you do, because if you don't have progesterone, you're at high risk of uterine cancer. And but why would they know that? Because they haven't been told that, because the GP hasn't told them that. So there's a real gap in communication and knowledge with everybody, and so I'm constantly just trying to fill that gap, and there are plenty of us trying to do that. It's not just me,
Yeah.
and it is really important. But I was quite pleased not to have to take my progesterone anymore,
Yeah.
because that was one less thing to take.
Yeah, definitely. Same here. It's made things a lot easier, and the GP said, this is going to be a lot easier for you because you're not having to worry about that as well.
So much
Um,
easier. Yeah.
Looking back on the experience, what were the worst and best bits of this whole thing? What would be your words of advice, if you like, to anyone either considering a hysterectomy, to opt for it like you did, or just preparing to go in for one because it's part of other treatments that they've been having similar to me? What would be your words of advice?
It's very individual, so that's quite a difficult question. So the worst thing for me, I think this applies to anything really. The worst thing for me was, I don't live for regrets, actually. Regrets isn't something I have, but the most annoying thing, rather than the worst thing, is that I waited so long to get things sorted,
Yeah,
and worried about it, and just generally got myself into a pickle about it. I could have had this done years ago, and I didn't. I suppose I didn't advocate for myself as much as I should have done, which I know sounds like a bit of a something I would say, being in my role, but actually I like to live the things that I say to people, and I don't think I did. I don't think I
yeah,
did advocate for myself enough. I allowed myself to be told it's fine if you want to poop yourself on a regular basis, and if you have postmenopausal bleeding, it's fine. It really isn't fine.
no,
And I often say to women, just sorry, I will answer the rest of your question, but I often say to women, when I'm in a consult, and I'll say, so any other symptoms that you're concerned about, perimenopausal symptoms? And they'll usually say, no, I think I've given you my list. And more often than not, I'll say, so just to double check, have you got any bladder problems, sort of leakages, urgency to go? Oh, well, now you mention it, well, only a little bit though. And I'll go, okay, so are we happy to pee ourselves on a regular basis? No. Okay, so let's do something about that, because it's really easy to sort. And we just kind of accept. And I was one of those people that accepted, well, this is just who I am. That's
yeah,
how I have to deal with life. So I do. The worst thing for me was taking so long to get to where I was, to get to where I wanted to be, and also the worry about it. I I worried about the operation more than needed, because actually the best thing was, it was 100 times easier than I thought it would be,
yeah,
and all that fear uh, uh, just was it just wasn't necessary. Once you'll know, once I had the op and once the that initial couple of hours was out of the way, I thought, oh, well, that was easy then. Um, and it really was. It compared to what you concoct in your mind of how difficult it's going to be. The communication and the question, asking the right questions, and all the prep gets you to the point where you think, actually, that wasn't so bad. It was okay. And I know that's not exactly top tips as such, but the worry and then the result are such polar opposites that I think that's quite important.
Yeah, definitely. I would say similar sort of thing. I actually, by the time I got to the point of having the operation, I was really not all that frightened of it, because I suppose, again, from my experiences, that I understood the surgical aspect.
Of course,
So it helped me quite a lot. I was more concerned about what they were going to find, because I'd already been diagnosed with severe precancer,
of
and the
course.
fear of actually it being cancer, I
Yeah,
think, outweighed the going in and having
yeah,
everything taken out. So
yeah, of course.
in some respects, I was kind of
Mm,
on the other side of the scale, really.
yeah. No, I get
Um,
that completely.
yeah,
Yeah, the best thing actually is no periods, no bleeding, no bowel problems, no cancer. Tick, tick, tick. All those things.
yeah, absolutely. I just to finish as well, Jane, I had a wonderful T-shirt that I wore after my operation that has the very same image that you've got behind you. It has a lovely uterus and ovaries on it, and it says, "Here to cancel my monthly subscription."
Nice. Yes, I definitely want one of those t-shirts. I like it.
Yeah, definitely.
Love it.
Well, Jane, thank you so much for taking the time to share your personal story and your experiences with us today. It's been a real pleasure to
Thank you.
talk hysterectomies with you.
Yeah, thanks. That's been
Thank
for
you
me
very
too.
much. Thank you
Thanks.
very much.